Alright, we will continue on with our assessment. Now I'm going to inspect your mouth and tongue and lips. Your lips are moist. They don't seem to have any cracks or any lesions in them. I'm going to have you open your mouth. And I'm going to look, just a little dark in there. And I'm going to have, just so I can see your tongue and look at your uvula and your teeth, I'm going to have you say ah. Okay. And that will check for cranial nerve 7 and 9. And then you don't have any tonsils. Your teeth appear to be, you don't appear to have any dental problems. Do you feel like you have any dental problems? No. Your uvula was midline. I'm going to put this down. I'm going to palpate. And your palate seems to be okay. And while I'm here, I'm just going to inspect them or try to palpate any lymph nodes. I'm going to check your pre-auricle, your post-auricle, and occipital. And I'm going to check your supraclavicular to infraclavicular. I'm going to palpate for your submandibular and your submental. No lymphadenopathy or masses noted. I am going to palpate just to make sure your thyroid is midline and that I don't palpate a thyroid. So I'm going to have you swallow. I'll have you taste something and see if your taste is intact. And can you taste that?
Chocolate.
I'm going to have you check range of motion on your neck as I've inspected it, and it's even tone with your skin. I don't see any problems. So can you turn it to the right, to the left, up and down, right, and without any pain? All right. I'm going to have you shrug your shoulders so I can check cranial nerve 11, and it seems to be intact. We're going to check some of your speech just to make sure it's clear without any slurring. So can you say tip-top?
Tip-top.
50-50?
50-50.
Huckleberry?
Huckleberry.
Okay. I'm going to check your tongue also. And I do this last because I have to pull on a little bit and just make sure. And I don't see any kind of masses, or I don't feel anything hard at all with that. Do you have any problems at all? Do you feel like it's appropriate?
Yeah.
And so, and your gums seem to be, you don't have any bleeding of the gums or any problems with that. All right, then we're going to continue on with your assessment.